briefing. It is now 8:15. I'm Julie Grauert, your facilitator for this event. I would like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Dr. Scott Lindquist, Acting State Health Officer, Lacey Fehrenbach, Deputy Secretary for the COVID-19 response, Dan Laster, Director of the Vaccine Action Command and Coordination, also known as VAX Center. And from Community to Community Development, we have Australia Tobon, Whatcom County Promotora Coordinator. To begin today's briefing, we will open with remarks from Secretary Shah. Secretary Shah, I think we're having a little bit of trouble hearing you. Can you hear us?
Can you hear me now?
Yes, I can hear you now, loud and clear.
Apologies, I had the wrong microphone that was opened up. So good morning, everybody. I wanted to just welcome you to our continued briefing on a weekly basis about what's happening with Department of Health activities related to COVID-19 and beyond. I just want to thank all of you for your continued hard work, and especially our media partners for everything you've been doing to help us get the message out, the accurate and the timely messages to our community. I also want to thank our partners on the ground. This has been a grind, and everybody knows how difficult this has absolutely been. And so I just want to say thank you to everyone. I want to start by acknowledging the news from yesterday, the conviction in the trial of Derek Chauvin for murder of Mr. George Floyd. And I do want to just echo the Department of Health. We had issued a statement late last night. If you haven't seen it, please refer to it. I think it brings up some important points. But most importantly, what I wanted to highlight is, again, the fact that while we are in the midst of fighting this virus, we're also fighting the two other public health issues that are of significant importance to our communities and to our state, which includes racism and violence. And the only way that we can work together to fight this horrific virus and this pandemic is that we have to work together. But also the only way that we can fight the horrific effects and impacts of both racism and violence and hate and everything that goes along with it is to work on it together. So yesterday was absolutely a first step. It was a necessary step, but it's obviously not sufficient. And we do recognize that a lot more work needs to be done with our public health and other colleagues around the state and around the nation. And so I just want to join everybody in working together in our commitment at Department of Health to both take on this virus, but also to take on the scourge of racism and violence as public health issues. So with that, let me also pivot to the fact that yesterday's conviction reminded us of the absolute importance of equity and why equity is more important than ever. And what we need to be doing is continuing to not just think about equity across the board, but also be thinking about equity in our efforts. We have to be intentional, we have to be deliberative, and we have to make progress. And so today, we're announcing that we're going to have new data and initiatives to support our vaccine efforts, our vaccine goals. And, there are a couple things that I wanted to announce today. One, I wanted to announce that we are setting a new goal for the state of Washington for 90,000 vaccines per day. So if you remember our previous goal that we set in the winter, it was 45,000 vaccinations on a daily basis we were going to achieve. At that time, we were at about 12 or 13,000, and then we well exceeded the 45,000, and now we're somewhere in the 50s, and actually we're at times at 60 plus thousand. So we've set a goal for 90,000 vaccines a day. That's 90,000 vaccines to be administered on a daily basis. That includes the absolute importance of the three-legged stool, which I'll show a little bit later, which obviously is about supply. It's about logistics and it's about demand. And the supply equation continues to be an issue for us. We're doing everything we can to work with our federal partners. We would have liked by now to have seen more steady increases in supply. We have made progress and we've seen progress from our federal partners. But as you know, because of production issues and other challenges, including the J&J pause from last week, that has continued to disrupt supply chain. So we still remain committed to our goals of vaccinating as quickly and as equitably as possible as many Washingtonians, but the biggest challenge that we have is vaccine supply. So as we set our goal today of 90,000 vaccines, this is an interim goal. It's what we're looking at from a 6 to 8 week period of time. We're going to reassess this goal on an ongoing basis, as we always have. And it's absolutely critical for us to not just be thinking about a quantity goal, but also equity goals. And what I wanted to really remark on is that we are also in just a bit going to show you some progress that we're making, and we're going to be releasing later part of this week or early next week, as soon as we get all the data verified, additional information on progress that we're making with equity related race ethnicity factors, as well as age demographics for not just at a state level, but we're working towards county level data. And I do want to give the caution that we are going to have to be careful in some counties where we may not have enough data in certain populations, and we'll have to be careful how we present that. So I want you all to know that we'll do everything we can to protect the privacy of individuals while we're also doing everything we can to share information with the public. The majority of our counties are seeing cases that are increasing and we've detected variants as well. There are now more than 361,000 confirmed cases of COVID-19 and more than 5,400 deaths. Our case rates are increasing in all age groups except those who are 70 years of age and above. Our sharpest increase are in those that are in their teens, starting at ages 10 and above to age 59. Hospital admission rates, as you've been seeing as well, this is on our dashboard, is also increasing in all age groups. And we've had a sharp increase in younger adults. Over the past week, there's been a 32% statewide increase in specimens that are testing positive for variants. Dr. Lindquist is on it and can speak more to this in the Q&A, but our largest increase this past week has been in the P1 variant, from 34 cases statewide last week to now 116, which means we've had a 71% increase in the P1 variant. Some of the P1 mutations, as you know, may affect antibodies' ability to recognize and neutralize the virus, and we're really concerned about transmission and infectivity potential because of these variants that are circulating. Most people are still vulnerable in our state. And so while we've made an incredible amount of progress with a quarter of our state being vaccinated, 75% are not fully vaccinated. So vaccines are absolutely working, and every month of positive progress moves us closer to the normal, but we know right now we're not going in the right direction. Let me emphasize this point. We are close to turning the corner. We are close to turning the corner in the state of Washington. But we are seeing the beginning of a fourth wave. And that means people need to hang on longer. We know weather is improving. We know people are going outside. We know that vaccines are making a difference. Our data are showing that. But we need people to hang on. I had the ability yesterday to take it outside. I was following Governor Inslee's advice, and I took it outside, and I saw the incredible weather and just the incredible beauty that the state has to offer. And it was amazing to see people walking near each other, and they had their masks perhaps below when they weren't around someone, but then they would lift it up over their nose and mouth, and they were spread out, even in public spaces, more than 6 feet. They were doing everything they can to be in their social bubbles. They were doing everything they can to have hand sanitizers with them when they were touching surfaces or about to eat or drink. They were doing everything they can when they were eating or drinking to keep those masks closed so they could pull them up completely over their nose and mouth. We're absolutely seeing progress in our state. I do not want any of us to feel despondent about the road ahead. The road ahead is strong. We're going to get there. I believe that almost every Washingtonian at this point knows what to do in order to protect themselves, the people around them, and the community members against this horrific virus. But it's making sure that we remember that and we take that into account every single day with every single action, because until we have more people vaccinated, we are still vulnerable. We know that all these steps help us make sure that we are safer in the activities and we're slowing the spread. We need to take these steps to protect one another. And I really absolutely want everybody to remember the incredible importance of getting vaccinated. We are starting to see, as I mentioned, continued issues on the supply side, and we can't do much about that. We're doing everything we can to work with our federal partners. We're doing everything we can to stress test our system. Governor Inslee asked us to do that over the last few weeks, and the progress from that showed that we have the ability, the capacity to be able to vaccinate a tremendous amount of Washingtonians if we just had vaccine supply. But we want to emphasize the message about vaccine confidence. We know the message from the last week around the pause with J&J gave all of us pause. And we all thought through, what does this mean for vaccines? We know that there are two very safe, very effective vaccines, Moderna and Pfizer. We know that we are now verifying the safety of this third vaccine. And it's not that it's not safe, it's that we want to make sure that we're understanding what we have learned in the adverse outcomes and adverse event system, the VAERS system, which allows us to track what's occurring with vaccines. And dutifully, we found as a system that we needed to take a pause with the J&J vaccine. We were hopeful this pause was only going to be temporary for a week or 10 days. As you know, the CDC ACIP committee met last week and they're meeting again. And we're hopeful that they will, at least if not lift the pause completely, provide additional guidance on which situations this vaccine can be used in. We do believe when that happens, we will again have 3 vaccines that are safe and 3 vaccines that are effective. The message to all of you, I've been saying, don't hesitate, vaccinate. I'll pivot to don't wait, vaccinate. So when those vaccines are offered to you and you're eligible, please don't wait. Don't wait for the weather to get better. Don't wait for the weather to get worse. Don't wait for it to be morning. Don't wait for it to be evening. Don't wait, vaccinate. And to our providers, you have somebody there. Now, everybody after Vax Day, 16 years of age and older, are eligible for vaccination. Our message for providers remains steadfast. Don't hesitate. Don't wait. Vaccinate. Get people vaccinated. This is our way out of this horrific pandemic. April is National Minority Health Month. And really, we want to share progress on update on equity. Yesterday, and you guys can show some of these slides here. As you can see, this is what we are planning on putting on our dashboard and on our website. As you can see, this is not just tracking our goals overall of 90,000 vaccines delivered or administered a day in the arms of Washingtonians, but it's the equity piece as well, to look at what we're tracking, what we're focusing on, what we're accentuating from all of the different communities that make up the incredibly, wonderfully diverse community that is the state of Washington. So as you can see, we're looking at the percent of total population. And again, we can just make sure that everybody recognizes that it's 16 years of age who are eligible for vaccine. So we are going to need to be mindful of the message that we have to compare it to the population that's above the age of 16, because obviously those who are under 16 aren't even eligible for vaccinations. So we're going to look at this across the board, and once we've worked through all of the details, this is what we're going to be putting on our dashboard, and you'll be able to see it updating on a weekly basis. We're tracking this so it allows you to look at all the different populations, what percentage they represent for our communities, and what percentage of vaccinations that they represent as well. We're making tremendous amount of progress in certain populations. We have a lot more work to do in all populations. I think it's absolutely critical for us to recognize that we have populations with gaps. We have populations related to both the Latinx community, African American community, that we absolutely want to focus on, but it's really all communities that we want to focus on and accentuate our efforts. We recognize that these data do not fully represent the experience of all groups or populations that are affected by COVID-19. We know COVID-19 has a disproportionate impact on so many communities across our state. But based on this information, as well as information on visits across the state, if you all can bring up the other slides, I had the opportunity this week to visit, for example, the Seattle Indian Health Board, and we had an incredible discussion about the challenges in the American Indian Alaska Native communities, concerns around data, concerns around protecting their community members, and not just their community members, but a broader group of individuals that they were not just seeing in their clinics, but also helping vaccinate. And what I do want to just focus on and just remind everybody is that it is really #InItTogether. It is all of us together working on these activities. Dan Laster is here, and he is going to be talking a bit about our public-private partnership, which we've had some incredible meetings this week as well. Dan, I want to thank you for that as you brought that together, because this has been such an incredible way of looking at public and private sectors working together, and it was just highlighted in a report, and Dan, you can speak to that as well, and I know you have some additional news that you want to share. Our goal is to ensure communities most impacted have equitable access to vaccines. That is our goal. We are not there yet, but we are doing everything we can, working with our local health jurisdictions, our local health department partners, who have just been incredible day, night, weekends, and holidays, doing everything they can to work with us, work alongside us, and certainly in partnership to make sure they're doing everything they can to vaccinate people in their communities. As I mentioned on Friday or early next week, we're going to add county level vaccine race ethnicity data to our dashboard. This is previously only at the state level. Sharing these data, we know, will give us the opportunity to work with our partners on the ground, our community partners, our private sector partners, to increase access for those who aren't getting vaccinated. This is another step forward towards transparency, and our response is really clearly on the heels of getting strong feedback from communities requesting local data to better see and address inequities. And I want to thank Australia Tobon for being here. I hope I pronounced it correctly, Australia. I got Australia right. I know that I got that part right. It was the last name. And Australia is a Whatcom County Promotora Coordinator at Community Development. She's going to talk about the efforts at local levels to vaccinate farm workers. And this has just been amazing. As you all know, Governor Inslee and I visited when the second gentleman of the United States came along with our team in Yakima County. We heard from Latinx community members. We heard from the importance of vaccinating farm workers and how those efforts really need to work together in complement. So I just want to say thank you, Australia, for the efforts, and I'm looking forward to your comments as well. So again, our new goal is 90,000 doses per day. We're consistently going to beat this goal, just as we beat the previous goal, but it's going to take us some time to get there. I want to show the last couple of slides here that we have delivered over 4.6 million doses thus far. Over 84% of delivered doses in the state of Washington have been administered to people, to Washingtonians. Over 25% of our state population is now fully vaccinated. And our transmission model estimates about 27% of the total population has immunity right now. But we have a lot more work to do. If I could show this next slide, just remember that it is about this three-legged stool. At the end of the day, it really is all of these components coming together with supply, with logistics, with demand. And again, that message of don't hesitate or don't wait, vaccinate, I can't say it any more succinctly. Don't wait, please vaccinate. I also want to have a plea to our community members. We know that some appointments are going unused. Some of that is because we are seeing some concerns around demand and the willingness of Washingtonians to seek vaccines. But we're still hearing stories of Washingtonians driving hours to still get vaccine. And we do not want that to happen. We want to get vaccines to where people are. But we're also recognizing people are making multiple appointments to try to see where they're going to get it first, which is fine. But once you know you're about to get that vaccine, you're going to go in that next day or 2 days from now, it's all set, you're scheduled, you're ready to go. Or once you get that vaccine and it's in the arms, your arm, your personal arm, your individual arm, we ask you to be kind and remind yourself to cancel that other appointment, to let the provider know that you've already received your vaccine or you're about to receive your vaccine. We want to make sure that the appointments can then be used for others. We are finding that what's happening in many cases is that we have individuals who are not canceling their appointments, and those appointments are being held for them, and then that individual doesn't show because they've already received the vaccine elsewhere, and that appointment can then not be given to someone else, and it becomes inefficiencies in our system, and none of us want that. So don't forget. In this case, I want to remind you to be kind and do everything you can to work towards contacting that provider. The final thing that I wanted to say was really, again, about the J&J update. As you know, the CDC Advisory Committee on Immunization Practices, ACIP, will meet again to talk about the pause. There was a de Beaumont Foundation poll that they polled individuals and people considering the J&J pause. It is clear that it's proof that there is rigorous safety monitoring that is working, that their poll showed that the pause did not decrease the likelihood of getting vaccinated. That is incredibly fantastic news. And it's funny because we want to recognize the fact that while we're working towards all this, we also want to look back. Once you receive a vaccine, you want to go back and say, what was the experience? We want that experience to be a positive experience. And in fact, that same poll showed that 87% of vaccinated people would definitely make the same decision again. That's incredible. It's a grind, but we are in this together. We're making strides on equity, vaccination, public-private collaboration. We know the weather is improving. Don't wait, vaccinate. Take it outside. We are getting close. We are concerned about variants. We're concerned about what we're seeing. We're concerned about the start of this fourth wave. We are concerned, but we're close. And I want all of you to hang on with us. So with that, thank you so much. And I'm going to turn it back over to you.
Thank you so much, Secretary Shaw. Next, we will go to Assistant Secretary Michelle Roberts.
Well, good morning, everybody, and thank you, Secretary Shaw. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. It's been an exciting week. It's our first week that everyone 16 and older is now eligible for the COVID-19 vaccine. It's really incredible that we are here just 4 months after starting this vaccination campaign. Dr. Shaw shared some of our amazing COVID-19 vaccine milestones with you. I'm really excited that we are rounding the corner towards 5 million doses of vaccine given in Washington state. Our partners on the ground are doing incredible work to protect people. I'm especially thankful for the work of our community-based partners to host information sessions and mobile clinics. Together, we're vaccinating more than 56,000 people on average every single day in our state. That's really incredible. Our 4 state-led mass vaccination sites continue to do great work. Since opening on January 26, they've given out more than 230,000 doses of COVID-19 vaccine. It's hard to visualize how far we've come in just a few short months, but this is incredible progress in a short time. Thank you for everything that everybody, the public, our healthcare providers, community-based organizations are doing to help protect the people of Washington. We are proud that every day tens of thousands of people are getting vaccinated. And once you're fully vaccinated, you can start doing some of the things you've stopped doing because of the pandemic. You can spend time with others who were fully vaccinated in private settings without wearing masks or social distancing. This means grandparents can hug their grandkids again, and friends can be reunited after spending so many months apart. We can see the finish line, but crossing it is a team effort, and all of us can do our part by getting a COVID-19 vaccine. That's the only way we'll reach community immunity. We know people are busy. We are encouraging our providers to expand hours and offer additional clinic times to help make it easier for people to find an appointment that fits their schedule. Our 4 state-led mass vaccination sites recently expanded their hours and are now open till 8 p.m. 2 days a week. We know many people have questions, and we want to make sure everyone has the information they need to feel confident about getting the vaccine. People can learn more about the vaccines, their safety and effectiveness, how the vaccines work, and other frequently asked questions on our website, covidvaccinewa.org. Dr. Shaw also shared the update on the Johnson & Johnson vaccine. I wanted to add that DOH also reached out to over 100,000 people who received the J&J vaccine in the last several weeks through email, text, and phone to make sure they're informed about the pause and know what symptoms to watch out for. Our vaccine forecast from the federal government shows our allocations, our state allocations for Pfizer and Moderna will remain consistent this coming week. We expect more than 370,000 doses of vaccine each week. For next week, the total includes just Pfizer and Moderna vaccine. The forecast also shows about 4,300 doses of J&J vaccine arriving in early May. Again, we hope to learn more about the J&J vaccine at the end of this week when the Federal Advisory Committee on Immunization Practices meets. Before I close, I want to say how proud I am of Washington for stepping up and getting vaccinated. If you haven't made an appointment yet, now is the time to do it. Head to our vaccine locator website and sign up today. Thank you.
And thank you, Assistant Secretary Roberts. Next, we will go to Australia, Tobon.
Hi, good morning, everyone. My name is Australia Tobon. I'm one of the 3 promotora coordinators with Community-to-Community Development. We coordinate C2C's Solidaridad, Apoyo y Servicio Frontline COVID-19 Direct Support Project with 12 promotoras in rural Whatcom and Skagit counties. This project was formed in early March of 2020 in response to farm workers being designated as essential workers. And from day one of the pandemic, farm workers have not paused their labor in agricultural production. As a farm worker-led organization, we knew that our communities were especially vulnerable to COVID-19 virus. Farm workers have historically been surviving on poverty wages, not had access to healthcare, adequate worker protections against pesticides, and workplace injuries. Our organization has been advocating for enforcement and better protections for over 17 years, as well as better wages and advocating for environmental justice policies that address climate change because the rising temperature have only increased the dangers. Because of all this, we responded immediately to our community's requests for information on the virus, the state's mandated safety protocols in the fields, and their desperate need for PPE. In collaboration with North Sound Accountable Communities of Health And with support of Representative Deborah Lakonoff, we have reached thousands of farm workers handing out face masks and bottles of hand sanitizer. With their support, we were able to gauge with the Whatcom County Health Department and the Skagit Health Department to provide portable testing sites that went to areas where the workers were. And now we're mobilizing families by hundreds to vaccination sites. From listening closely to farm workers, we know that strategies to encourage vaccinations must be based on trusted community voices. We have to work to build trust in institutions that have not been listening. And they must be welcoming with faces and voices they recognize, trusted community members that look like them and that care. We developed this model as a result with collaboration with North Sound Accountable Communities of Health and Peace Health to provide low barrier clinics and also COVID-19 education. Many of our farm workers have not gotten any information about the vaccine or the comparisons of the 3 vaccines and the different things to know about and side effects. And we also believe there must be follow-up for any possible side effects and to see if the families need any kind of support. Ideally, there must be a reassurance from employers that if they schedule a vaccination during the day, they are able to get off work and not lose pay. If that does not happen, then the timing of the vaccination clinics needs to be after farm workers get off work. And they must be afforded the dignity of being able to stay home if the vaccine makes them ill and again, not lose pay. Thank you.
Thank you, Australia. Our final panelist will be Dan Laster. Dan?
Great. Good morning, Julie. Good morning, everyone. I'm the director of the VAX Center, and VAX is all about bringing partnerships together to work with the state and what I call the vaccine ecosystem of the state of Washington to make sure we can get the shots into the arms of all Washingtonians. It's really been extraordinary how in just a few short months, our private sector partners have come and really rallied and supported the state in its efforts. And Dr. Shaw was mentioning just last week, the Duke Margolis Center issued a white paper and recognized the VAX Center and the partnerships that we've been able to develop and deliver in terms of the vaccine locator tool and the call center enhancements as a model across the United States in terms of how to bring everyone together to help in this effort. The goal of VAX really is to make sure that we can get vaccines in the arms of all Washingtonians in the fastest way possible, in the most efficient way possible, and in the most equitable way possible. Our private sector partners are really committed to equity as well. And we have, the VAX initially focused on the issue of finding out where there were vaccines available, where the providers were, how to make appointments. And I think we've done a great job in making that easier. Starting over a month ago, we started looking at the issue of, well, just because you have an appointment, that doesn't mean it's going to be easy for all Washingtonians to get to those appointments. So we really focused on the issue of easy access. And we know that there are barriers, even if one has an appointment. And we've been working, and the first piece of the puzzle, candidly, we've been able to partner not just with true private sector, but transit authorities. So in March, you may have heard that Sound Transit announced that it made free transit available on its light rail, partnering with us. And Pierce Transit has also done the same. And so we're really pleased. Those are what I view as the first steps in making it easy for all Washingtonians to reduce the barriers for all. We currently have other discussions underway. We're still putting the pieces together, but I am hopeful that in the next few weeks, we'll be able to announce some other partnerships to make it easier for even more Washingtonians. And also the focus being looking across our state. Obviously, we've got both those who live in urban areas, those who live in rural areas, and we're trying to focus across the board to make it easy for all Washingtonians to be able to get to vaccines and get shots in their arms. You know, and looking at this really is a situation where communities know best. Communities know what their problems are, and we need to look to community solutions. And so in that vein, I really do welcome any other partners in communities across the state of Washington to help us. And if any other partners, private sector, quasi-governmental partners want to join our effort, we really do welcome you reaching out. You can see our how to get in touch with us. We do have over 50 partners now, and it's just amazing. We're now entering that additional phase where we need to make it as easy as possible for everyone to get vaccinated. Thanks very much.
Thank you, Dan. This brings us to the question and answer segment of today's briefing. We do have several media with questions today, so if we are not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question comes from Ariel from the Spokesman. Go ahead, Ariel.
Great, thank you. I'm curious, is the Department of Health prioritizing vaccine shipments to providers who had clinics scheduled with Johnson & Johnson doses this week due to the pause? And then how many Johnson & Johnson doses do we have waiting to be used in the state currently? Thank you.
Michelle.
Yeah, we can follow up with email on the exact number of J&J doses that were already in the state when the pause happened. This week, there was no Johnson & Johnson vaccine ordered or coming into the state. And reminder that last week when the pause happened, there was only about 12,000 doses of J&J vaccine was in our state allocation, which was less than 5% of our total vaccine. So it is such a small amount. We haven't necessarily had to prioritize those providers, but we are definitely making sure all providers have Moderna and Pfizer vaccine to use instead. So definitely working with everybody to make sure vaccine is still available, and any providers that have Johnson & Johnson vaccine have other provider have Moderna or Pfizer vaccine.
Thank you, Ariel. Our next question comes from Jessamine with Q13. Go ahead, Jessamine.
Thank you so much, and thank you for your time. I am wondering about with people starting to travel, even if fully vaccinated. You mentioned the P1 variant. I was hoping that you might be able, maybe Dr. Lindquist can go into that a little bit more, and how likely you think with the variant spreading and people traveling and starting to move around a little bit more, how close are we to going backwards?
So let me just say one quick thing, and just to tee up for Dr. Lindquist, is that the P1 variant is what I referred to, but I do want to be known that we're going to be releasing our variant sequencing report later. And we are also looking at B117. But in general, the concern around travel is very much about this real conundrum where, folks that are traveling, if they're vaccinated, it's one thing, fully vaccinated, and 2 weeks after their second dose. But there's also the concern that you have others who are not vaccinated who are traveling, and airlines are being very restrictive and very strict about wearing masks. Certainly that's what's happening on flights and boarding. You do want to make sure that in all the other places, whether you're picking up a rental car, dropping off your bags, or even just eating or drinking in the airport, that people are doing all the other things that they need to do in those occasions where you can have potential for transmission. So it's not just what's happening on the actual flight itself. So it's really about all of that together. We're obviously following the CDC guidelines, but we're also making some specific looks at what it means for us from a state standpoint related not just to variants, but also to the level of vaccinations across our state. Scott?
Yeah, and I would echo that. I'm less worried about travel because these variants are here. And so two very important things that happen since last week is the B117, or the UK variant, has now become the predominant variant in Washington state. It was projected to be the predominant variant, and it crossed that threshold this week. And you'll see that in the variant report that it makes up the most of the recent. So B117, the UK variant, has increased transmissibility. So this couldn't happen at a worse time when people are starting to be outdoors more, to relax their restrictions, et cetera. So it's not so much travel that I'm worried about, because even if you travel to UK, we've got this UK variant here. And if we're relaxed in our mask wearing or social distancing, it's going to spread within the state, as evidenced by it increasing as the most predominant strain. And the other strain, of course, is this Brazilian strain, or P1, which has gone from virtually small numbers to about 7% of our variants this week. And P1, of course, is spread more easily. It is still covered by the vaccine, but it tends to be a little more severe. And so it's very disturbing we're seeing such a rapid increase in P1 while we're on the border with British Columbia, that has had a very significant P1 outbreak. So that part of travel is concerning, but of course the border is not open to non-essential travel. So, but in Washington state, you can still get P1. So again, it's not the travel I'm most focused on, it's the lax restrictions that people are demonstrating. You just have to walk in downtown Tacoma or Seattle or Yakima, and you see a lot more people out. They're close together, and for the most part, people are wearing masks. It's just a time for us to reemphasize you really ought to wear your mask every single time you're outdoors. That's it.
Thank you. Our next question comes from Steve at Como. Steve?
Thanks, Julie. Appreciate the time. A couple of questions. One regarding the Johnson & Johnson vaccine. Has the DOH seen any local issues with people that have been given that vaccine so far? And then regarding the phases, I know the next assessment isn't until May 3rd. Dr. Shaw mentioned that we're seeing rising case counts and hospitalizations in many counties across the state. To be frank, what are we doing wrong? And are there specific sectors that are being affected by some of these rise in cases?
Thanks, Steve. Let me take maybe a couple of parts of both questions and then turn it to Michelle for the vaccine, J&J on the ground, as well as Lacey on the roadmap. On the J&J on the ground in general, we have not heard, and we've asked of our providers as well, but we have not been aware of anything that has been individually related to the J&J vaccine, to my knowledge, but Michelle can confirm that. Lacey can talk about the phases, but what I will say is that I'm not certain it's anything that's done wrong. I do think what Dr. Lindquist just said about the fact that, look, the weather got nice, and when things look better, people tend to forget that we're still in the middle of a pandemic. And while you're outside, and if you're away from others, and there's no one around, and there's one way of wearing your mask or not wearing your mask, or one reason for it or not. But if you are absolutely outside around people, and you didn't even bring your mask with you because you thought, gosh, I was going to be in a not crowded area, I was going to be somewhere remote, and you all of a sudden you're not, someone's around you. That's the kind of stuff that really gets us concerned, that people are really, all of us want to be through this pandemic, but that's the challenge that we have, that we're not through it. The last thing I would say is that we are, as I mentioned, that the increases we're seeing are in the ages of the teens, 10 to 59. So these tend to be people that are out and about doing things. There's obviously less vaccination coverage in that population than in our seniors. So these are areas of concern. And so again, we still have 3/4 of Washington that are not vaccinated. And we want to make sure we're doing everything we can to protect people with those preventive practices, but also to get vaccinated as quickly as possible.
We don't know, as far as follow-up on the J&J, anything specific about any possible reactions or potential reactions here in Washington State, but we do hear about potential reactions from time to time from people who reach out to us directly or from healthcare providers. And we do several things to follow up. First, we make sure there's a VAERS report that has been submitted. And then we also follow up with CDC to alert CDC to what things, to any potential reports that seem more serious, to make sure CDC knows they're there and they're ready to take action on them immediately. We also do, Dr. Lindquist and others provide sometimes medical consultation, and then also we can link to CDC for further types of medical consultation, including what's called a CISA assessment. That is really a clinical consultation around potential vaccine side effects with groups of expert doctors. Those proceedings are confidential, but what we can do is help link providers who are interested in kind of further clinical assessment with CDC and with the experts to do that further investigation about potential side effects.
Thank you. Our next question comes from Nicole at Cairo Radio.
Julie, real quick. Yeah,
Dr.
Lacey,
Shaw, go ahead.
Lacey had a follow-up.
Oh, all right. Please go ahead, Lacey.
I'll be really quick, Julie. So Steve, back to your question on the roadmap and what we're doing wrong. I think Dr. Shaw covered this overall really well. For context, I do want to share, our disease levels are where they were in early November. That's the bad news. The good news is the slope of the increase is not as steep as it was in November. I think the challenge we're all facing is we are in this race. We're in this race to slow the spread enough while we vaccinate as many people as quickly and equitably as possible. And the challenge we're having right now is we cannot vaccinate our way out of increasing disease levels. We are going to have to use the tools that are available to all of us to slow the spread. So, that is wearing your mask, it's watching your distance, it's keeping your social circles small. And that one is really hard for all of us. We have been isolated for more than a year now. We have missed our friends and family. We have missed doing the things we love, whether it's sports or, barbecues or arts, whatever it is. We have missed being with people. The challenge is the more people we're around, it's not just those people you're exposed to, it's their contacts and beyond. And we just have to hang together a little longer here so that we can win this race and turn the trajectory of disease around. We are vaccinating more, you saw 55, 60,000 people a day. So really the summer is hope for us if we can do all of those things that slow the spread while we vaccinate.
Thank you, Lacey. Our next question comes from Nicole at Cairo Radio. Go ahead, Nicole.
Hi, everyone. Thank you for taking my question. We've seen several counties, Skagit County, King County, that have been right on the brink or a little bit over with numbers for several days at a time. I'm wondering how many days a county would have to be over those case and hospitalization rates or right at them before you would consider sending them back in between the 3-week intervals.
Yeah, I'll turn that to Lacey, but let me just make one comment, which is we've made it also clear to our local health officials that if they do feel that there is a concern in their community, obviously work with us, tell us, talk to us, but they do have the ability to also move their county back if they make a local decision based on that as well. And we've said that throughout this. Lacey, do you want to add some additional detail?
I can say that we're looking at the data, both the metrics that we assess for counties as well as health system capacity on a regular basis, daily even. We do not take lightly at all the decision to move a county, at the reporting period or in the interim These are extraordinarily different or difficult decisions to make and risks to weigh. So we are watching the data in all of our counties very closely. And as Dr. Shaw said, we can, in consultation with, move a county early. The county could choose to move themselves early. At the moment, we are planning to move as the cycle dictates, announce on May 3rd for movement later that week. But we are monitoring it very closely, and given where we are with disease, we are concerned.
Thank you. We now go to a question for Australia. Australia, in your role as an advocate, as you're helping to connect farm workers here in Washington to necessary and life-saving resources, what do you think is needed to make mobile vaccine efforts as successful as they can be?
Yeah, that's a good question. Thank you. One of the things that we have recognized through our partnership with Peace Health and North Sound Accountable Community of Health, they have helped us work with vaccine allocations and providing low barrier events for vaccines. So we noticed that when we are calling community members or talking to like elders in our community, many of them have not gotten I guess you would say like a consultation about the vaccines. They're unaware of their options and their right to choose. We've also got comments that farm workers want the very best vaccine because of their essential work. So for us, when we hear these things and feedback from community, we want to make sure the process is very low barrier. We're not asking so many questions. There has been, complaints from the process of using PrepMod and our communities being asked, a lot of different questions. Can we modify our practices on a local level so it could be a low barrier event? So because of that, we've served over hundreds of farm workers in Whatcom and Skagit County and their relatives. And essentially, we don't do a lot of outreach. It's really a word of mouth and testimony of what happened at those clinics. So having them more accessible at different times of the day, getting feedback after farm workers get vaccinated for their first dose. We do follow-ups and community surveys about what was the highlights and not so great experiences from the community clinics. And our partners have been so open about modifying things to making it a welcoming environment, signage, interpretation, respect for language, linguistic diversity, since most of our Spanish speaker, or most of our farm workers in our areas speak a language other than Spanish. Also to vaccine hesitancy, even at the site. So it is continually walking them through the process and letting them know what they're getting themselves into, and also letting them know like what are the ingredients of the vaccines. But that does come with pushback from community, and we're continually learning with community strategies to overcome vaccine hesitation. But they are equally involved in this process. Our promotoras, which are also known as community organizers, are farm workers. We're farm worker women. So we do know that experience, and to make it a welcoming experience as possible, and changing the times and days that appointments are scheduled, reserving slots for us so workers can get in right after they get work or when they get time off. It's multiple factors that come into play for this question. Mm-hmm.
Thank you so much, Australia. Our final question is from Evan at the Seattle Times. Evan?
Thanks so much. 2 questions. I'm wondering, with P1 in Washington State, are we seeing a rise in cases of reinfection? Maybe that's for Dr. Lindquist. And then I'm also curious about the gender gap with vaccination. Is that why does DOH believe that that's happening? And is that a function of demographics? And what is DOH working on with regard to gender and vaccination?
Scott, Scott, Michelle?
Yeah, Yeah, I could take the first part. Evan, we are not seeing an increase in reinfection due to P1. There's two things we're doing for anything that's a reinfection or anything that is a breakthrough case. So people that have been vaccinated that develop disease, we are doing genotyping on those. And really, we haven't had enough data to say that there's any clear trends. We are seeing all the variants as they're represented in the population showing up in breakthroughs and also in reinfection. The concern, I think it's a good concern that you're raising, is at some point, are we going to see breakthrough or reinfection with these more aggressive strains? Unclear, but no evidence of it right now.
Thank you.
And as far as the second half of that question about the gender gap, we don't have gender on the external on our dashboard yet, that we are working to get that added. But there is a gender gap with vaccines, unfortunately, and there are more women, a significant amount of more women who are vaccinated than men. So in our state right now, there is about, as far as females, there is about 57% of females out of the total amount of vaccines given. About 57% of them are women, female, and about 42% of people fully vaccinated in our state are male. So that is a significant difference. There's probably a lot of factors that play into that, but one of the biggest is that women are traditionally the healthcare decision makers in families and more likely to seek out healthcare on a routine basis. So that's seen across a lot of different preventative types of healthcare, that gap and kind of a difference there. So part of it is continuing to understand what are all of the strategies we've mentioned before. What are the questions and concerns? What information do people need to feel confident in their decision to be vaccinated? And how can we make sure that information is out there? As Australia said, who are the trusted messengers for different populations, and really using them to help share information and have conversations with people. A lot of people do need extra information. We're asking people to do a health behavior, and they need to feel good and confident in that decision, and make sure they have the information they need and understand what the process will be, and also make sure there's access for the vaccine. So those are all different strategies we are working on, and we will continue to work on. We're also working with healthcare providers across the state who are one of the most trusted messengers anytime for immunizations. And with COVID vaccine, if we ask, who do you want to hear from? It is their regular healthcare provider. And so working with healthcare providers to look at, to work with the people who are their routine patients, reach out to them, encourage them to be vaccinated. And that's especially important for anybody who has a high risk condition that could make them more at risk for severe disease if you were to get COVID. Really let those people know that we want them to be vaccinated and encourage them to be vaccinated. So that's another piece of our strategy.
Thank you. This concludes the question and answer segment of our briefing. Now we will go to Secretary Shaw for closing remarks. Secretary.
Well, thank you again. Thank you, Julie, for hosting us today and facilitating us. I also want to thank Dan Laster, Michelle Roberts, Lacey Fahrenbach, and Dr. Lindquist for joining. And in particular, I want to thank Australia Tobon for doing everything you're doing every single day, and certainly joining us this morning to share those insights of what and how important promotoras are to our community efforts. You know, with the work that I had done previously in Houston and Texas, we absolutely recognize the incredible importance of promotoras. So I just want to say thank you. Keep up the great work. Keep smiling, and really just the efforts that you put towards improving the health and well-being of community members every single day. We really appreciate that. I want to just close by saying that, you know, we are very close, but we have some concerning trends, and this beginning of this fourth wave is concerning to all of us. The variants that Dr. Lindquist and I spoke about are concerning to all of us, and the fact that people are frankly data showing being more mobile and being out and about, which is in one sense great to be outside. But if you forget that we're still in the midst of a pandemic, that's when it gets you in trouble. And we want to make sure that you remember that, do everything you can to help us. Again, don't wait, vaccinate, and be kind and remind yourself to cancel an appointment or tell that provider that your vaccine appointment isn't necessary because you've already received it or about to receive it elsewhere. So I just want to say thank you to our community members, thank you to our partners, and certainly thank you to our media partners for everything you're doing to help provide and amplify accurate information to the community. And with that, thank you again to the team that was on, and I'll, Julie, turn it back to you to close.
All right, thank you, Dr. Shaw. And echoing your statements to all of our panelists today, this concludes today's media availability. We'd also like to thank TVW for hosting today's live stream and for the archives of past briefings. Thanks again and have a great day.